All right, welcome everyone to the COVID-19 Community Resources.com Town Hall meeting powered by the Center for Closing the Health Gap. I am one of your hosts today. I'm Cincinnati City Council member Jan-Michele Kearney, and I have two dynamic co-hosts, Tropikana, radio personality 101.5 The Wiz, and also business owner Lando Chapman. So we are going to be co-hosts today. We have two fantastic guests, Dr. Melba Moore, our Cincinnati Health Commissioner, and Dr. Senu from UC Health. Our topic today is the flu vaccine. People are scared to take it. We wonder, should we take it? How does it interact with COVID? There have been a lot of questions and comments about that. We need to find out the real deal, and that's what we're going to do today. So first of all, got to do a shout out to our tech team, John Reichel and Lauren Harden. So those of you watching on Facebook Live, just put your questions into the chat and Lauren will get them to us. And those of you who are on Zoom, you can put your questions in the Q&A and we will all get them to our panelists. So thank you so much, everybody. Thank you for joining us. Just want to remind everyone, of course, we record these sessions because we rebroadcast them on COVID-19 communityresources.com and actually lots of other platforms. So it's just good to have them recorded so we can share. All right, so let's get to our panelists. Our panelists have some introductory remarks. Well, you know what? First of all, let let my co-hosts Tropikana and Lando kind of weigh in here and say hello to everybody. Tropikana?
Unmuting. Hey, good afternoon, guys. Excited to be a part of the town hall again. Nice to see you this week again, Miss Jan-Michele Kearney. You know I gotta say it like that. As well as my guy Lando. I just want to say I'm so excited to learn. Every time we get on these town halls, I get a chance to learn so much. So I have a lot of questions, and I'm excited that Dr. Melba Moore and our other guest is here to kind of just dispel some of those myths and those notions that we don't really know to be true. So excited.
That's right. We're gonna dispel those myths. This is where you come to find the real deal. We're gonna give you the truth. We're gonna get rid of all those rumors and myths and tell you what the real deal is. That's why we're here. Okay, Lando Chapman.
Hey, Cincinnati, how you doing? Yes, definitely. Hey, Cincinnati, I'm excited to be here as well. And first, I want to thank all of you, this co-hosting this, for your commitment, to just keeping Cincinnati informed and using the platform to educate. Because I think that's what's missing, and the more dialogue that we have, the more that we're able to address a lot of the questions and kill a lot of the myths and a lot of the rumors. So I'm very excited to be a part of this as well.
That's right, and knowledge is power. Now, so get your power here. We should also say that Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap, is here, and she's going to weigh in at least at the end and maybe during the presentation as well. So just know that she's here standing by. So thank you so much, Renee, for being a part of this. Okay, let's introduce our guests. We have two guests today, Dr. Melba Moore, our Cincinnati Health Commissioner, just doing such a fantastic job out there, keeping us healthy and safe, and all those pop-up testing clinics for COVID. And she is busy. She's everywhere and just, really doing such a great job. So Cincinnati owes you a huge thank you. So thank you, Dr. Moore. And we also have Dr. Senu from UC Health. And Dr. Apawakan said, you can call me Senu. So it's like, he's going to make it easy for us. So we're going to call you Dr. Senu today. Although I love the name Apawakan, I kind of like saying it. So, and I bet Tropicana would enjoy saying it too, because she likes that kind of stuff. But we're going to keep it simple. Okay, so let's start with Dr. Moore. And Dr. Moore, opening remarks.
Certainly. Well, first, let me say this. I think we never say thank you enough. And Lando and Tropicana, thank you so very much for being a part of the panel, the virtual town hall this summer. Because of you, you gave me information that was powerful. We went into the community and held a pop-up testing site because you knew where people would go. And that's what this is about. providing people with information and listening. We know that the country listened early on when the comments were, don't wear a mask. We know that. But the reasoning behind that didn't come until much later. And I just want to remind everybody in Tropicana, every time I hear your voice, I said, she's taking care of it for me in a community that I can't get to. And that's what this is about, partnership. So I appreciate your partnership.
Thank
So
you.
we know early on that there was a shortage of masks, personal protective equipment. And that's why that message was not to wear the mask, but for us to save the mask for our healthcare workers and our first responders. Well, as the shipments started to come in, then we changed that message. And that had the community really confused. And I think for the most part, we're seeing about a 76% rate of people wearing a mask. We have seen since the mask ordinance for the city and the governor's order for the mask going into effect, we have actually seen in 5 weeks a reduction in cases. No, people are tired. I know they're tired of hearing about pandemic, COVID, and the purpose of wearing the mask. Stay masked up, social distancing to protect each other and so that we can get through this. So today we're going to talk about flu. And we know that October really kicks off flu season, and it runs from October to May. Influenza or flu and COVID-19 are contagious respiratory illnesses. I'm gonna say that again, they're contagious respiratory illnesses. However, COVID has surpassed the impact not only across the country, but within the communities of color, in our Black and brown communities. Because we know more of our Black and brown brothers and sisters were greatly disproportionately impacted by COVID. Should you get a flu shot? And I will say yes. And I look forward to the rest of our discussion.
Thank you so much. But we're gonna get back to those points because some people are like, I don't think I should get a flu shot. So we're gonna talk about that. Okay, Dr. Senu, opening remarks, please.
Thank you again for such a great opportunity. I've never participated in this panel. I'm really honored that we have such a vibrant and lively crew to discuss matters that are really pertinent to the community. Now, as an infectious disease physician, I value partnerships, and partnerships are incredibly important in maintaining the health of the community. So partnerships are important. So I really Dr. Melba Moore put it really right that, the help that that we get from interactions with our partners helps us to make better informed decision. And that's why this is important. This flow of information back and forth is incredibly important in maintaining the health of a community. So my message, which to everybody and to and anybody who's listening is, I mean, we have, as Dr. Moore rightly said, we have heard a lot about COVID, and COVID has assumed incredible importance, which rightly so, because it's a very deadly disease. But one thing we should not forget is that influenza is also very deadly. Now, the other thing I would say is that, and we have actually published work on this, that viruses can travel in pairs. So viruses, flu can travel alongside COVID. And we have found that when they do travel in pairs, they actually do more damage than when they are singly for the most part. So it is very important to get your flu vaccine so you don't get flu and COVID, because the very way you can get COVID, you can get flu through the same methods. So if you prevent yourself from getting COVID, you may prevent yourself from getting flu just by using the same methods. So it's very important for us to get our flu vaccines so we don't have, COVID and flu, which could actually make things worse. We're already struggling dealing with with all the problems COVID is impacting on the Black and brown community. So we want to prevent any worse problems. The other thing I would also mention is that the symptoms of COVID and flu overlap a lot. So if you don't get your flu vaccine, and even if you get the flu as a result of that, you're going to be very anxious, asking yourself, is this COVID? Is it flu? Is it COVID? Is it flu? You know, it really could really create a lot of anxiety. So this is one less problem to deal with. If you had the flu vaccine and you don't get influenza, it's definitely one less problem to deal with. So I would highly encourage everyone to get the flu vaccine. And remember, flu is very deadly. Young people die from flu. Yeah, and I think there's sometimes a misconception that, oh, you know, I'm young and so I cannot die.
Mm-hmm.
I take care of young people. I have lost young people to influenza, and so it's a very deadly disease. So that's my spill, and I would, you know, pass it over to you for questions and comments.
Thank you. Thank you for that intro. We're going to get back to those points. I wanted to go to Tropikana because she has some questions from her radio listeners, I think, about the flu, so or COVID. So Tropikana.
First of all, thank you, Dr. Senu, for even joining us today. You kind of touched on a couple of the points that were questions that I have received. One in particular about the flu and COVID. So it is very possible to catch the flu during COVID season. I know when COVID first broke out, we had this conversation a few months back about how I immediately thought that everything was COVID. Like, okay, my nose is running, I have a headache. This has to be COVID. It was actually just allergies. So how can we tell the difference between when we have COVID or when we have the flu?
That's a good question.
I can take that if you want me to. So there's a lot of overlap between the symptoms of flu and COVID, unfortunately. So it is very difficult to say this is flu or this is COVID. The best way to do that is to get a test, to see a provider who can test and tell you the difference. Having said that, and I don't want this to be the focus of the discussion. There are things that COVID does that are more common in COVID and less common in flu, like the loss of taste and loss of smell are more common things you would see with COVID than you would see with flu. But for the most part, in the first place, not everybody's going to have loss of taste and loss of smell with COVID to begin with. So the fact that you don't have it, that doesn't necessarily mean that you don't have COVID, right? So those are all problems and reasons why the only way I would say that one can distinguish between two, and there's no other way probably, is to confidently distinguish between the two is to get a test. And I think that would be a take-home message.
We just jump, Tropikana, let me just jump in real quickly because I know we're talking about how we know COVID's dangerous. I don't know if people know that the flu is dangerous, but would Dr. Moore or Dr. Senu, do you have numbers on,
Sure.
You know, like and this is kind of morbid, but what the annual death rate is from the flu? Because I think people don't take the flu that seriously.
Right. Last year in the United States, there were 24,000 deaths. 410,000 hospitalizations from influenza. And early on with COVID, we were watching those numbers and saying, you know, flu is more harmful. And this was early on. And of course, and the numbers I just gave you were from the last flu season. So you can see we have certainly surpassed those numbers with COVID. And we're still getting cases, you know. Right. So it's very important that we tell people flu is deadly, it can be fatal, just like COVID. Different kinds of symptoms. However, there are two viruses that attack the respiratory system. So we want people to be educated about that. And then to Dr. Senu, what he said is so important. If you're in doubt, get a test. And you know, you've heard me say the purpose of getting tested is so that it's a moment in time. When you take that COVID test, it's a moment in time snapshot that says, If I'm positive, here's some things that I need to do. You start thinking about, where did I go? What did I do? And it's the simple things that I want people, our community, to understand. Do I have to, or do I want to? Do I want to go to this event? So I have to put my younger sister's hat on. Do I want to go to this party, or do I have to go to the party, right? Do I have to go to work? And we know that our essential workforce was greatly impacted. And I keep saying essential because when businesses shut down, those essential workers, when businesses stood back up, it was the essential workers. So, you know, we always talk about trailblazers. We were at the mercy of our essential workers. And that's why we have to balance this thing, this economic, stimulate the economy, but balance it through public health messaging and being safe, putting the mask on, and social distancing.
Absolutely. You know, I've got to just chime in here because when I had COVID, so the day before I started having symptoms, I was in a small office with my 2 interns, but we were all wearing masks. And, you know, when I had the symptoms, I said, you know, let's all go get tested. And they were both negative, and my husband was negative as well. So, and my daughter. So unfortunately my son wasn't, but my daughter, my husband, and my 2 interns were all negative, and I was positive. So wearing a mask really makes a difference. So, yeah. Tropikana, back to you.
Dr. Moore, you made a comment in your opening statement on this last comment about how we were saving PPE for our essential workers early on. And you said something to me that stuck out. You said that this was the beginning as we were beginning to understand COVID. One thing that we have an issue with in my demographic and the demographic younger is that we think that the first thing that we hear is the end all be all. But can you kind of speak to how new COVID is and how things are developing and information is changing? Because one of the things that we heard about the flu versus COVID is just like the flu, because that was the thing that they said early on, and they took that and they ran with it. So now as it's gotten more dangerous and the more information we've learned about it, people are still believing that COVID's not any different than the flu. It's not that bad. They said that in the beginning. Can you kind of speak to that?
Words are powerful and we have to be so careful. And I don't know how many times I said it, and Dr. Senu has probably said, this is a fluid situation. It's fluid. I'm telling you, when I was in the very beginning, and that was in January. Now I'm your health commissioner, and I stood up the incident command January 29th. And I was sitting there going through my mind the things that we needed to do. If you had asked me at that point in time, when this thing was going to be over, I probably would have told you, give it 6 months. Mm. What blew me away is when I kept sitting there and I would have conference calls with, one of my colleagues, and I kept saying, okay, in May, it's going to peak in May. I believe it's going to peak in May. And then we had this anomaly one day, and it scared me. We had 60 cases in the afternoon. I said, uh-oh, we're peaking now. This was like April. Wow. The peak for us didn't come, but you know what? I watched my home city and I watched Ohio. And I heard something today that kind of hit me. My home city has had more cases. The positivity rate is higher in St. Louis, Missouri than it is here. I think when I looked at it on Friday, it was about Dr. Senu, I think our positivity rate is about 3.3 or 3.4%. When I looked at Florida, you're talking about 17% positivity rate.
Oh, wow.
Ohio, and this is what I want our community to know, our Black and Brown community and our region and our state. We're doing better than other states. But in order for us to move this along, we're going to have to do those things. Just listen. to the messaging as it changes and becomes more fluid. Wear the mask, maintain 6 feet. That's the best thing that we can do. And you're right, the messaging has changed over time. You know, you hear when we know better, we can do better, right?
Right.
Mm-hmm.
As we learn, we can do better. And that's what's happening. That's why you got to stay tuned, stay in tune to the real messaging. And that's where you get it in platforms like this. So I just implore the community to stay tuned, listen to the health experts. Dr. Senu, I'm a business doctor. I'm not a medical doctor, but listen to our medical professionals here. Listen to those voices here. Dr. Fauci, listen to him. And I know I'm not going any further than that. Listen to Dr. Fauci, CDC, and what's happening here, okay?
I love Dr. Fauci.
Okay.
Just follow along,
Right.
but it is fluid. Thank you.
Actually, I would, I'm going to touch on that. And I think I'm going to touch on that. I'm going to actually elaborate on why I think what you said is incredibly important. And I'm going to give you examples of that. But before we do that, I just wanted to mention, I like the comment that you passed about, and one of the reasons we want to test, and I think, Dr. Moore, you touched on this, is there's also, apart from the fact that you want to know whether you have COVID or not, let's remember that there's a public health responsibility to if you have COVID and you go around your life as you never had it, the chances are you're gonna spread it to other people, and people are gonna lose their lives. So I think it's very important, and I think the events that are going on just highlight how important it is that, apart from recognizing that we have a responsibility to ourselves, we want to be healthy, we have a responsibility to society, and that's important in everything we do. And so these decisions are they're far-reaching. They are not just decisions that impact us. We should recognize that these decisions also impact the community as a whole, and your friends, your neighbors, your loved ones could be impacted by the decision you take. Yes. So testing is very important. The only way you're going to be if you have COVID and you know you have COVID, you're going to take certain steps to prevent spread to other people. And that's really part of why this testing is important. And that's why I would always recommend that if you have any doubts as to whether you have COVID or flu, get tested.
Okay.
The second part is just, again, to highlight on what Dr. Moore has said. For decades, scientists have worked hard to keep politics out of science. We've done that for decades. I would be honest to say that I think in the last few years, those boundaries are being crossed more and more.
Yes, they are.
The problem with when science is infused with politics is that, you know, the interpretation of science, the science is the same, it doesn't change. Sometimes what happens is that when politics gets infused in science, the same science will be interpreted by one politician as this, and then the other will interpret it the wrong way. What you don't want is you don't want to go to your doctor's office, and depending on his political party, he's going to look at the same evidence and give you one piece of advice. And then another doctor, depending on this political party, will give you a different piece of advice. So I don't want to go to my doctor's office and depending on whether it's Republican or Democrat to tell me to wear a mask or not to wear a mask.
Right.
So we are in that era, and I think a lot of things are happening that is highlighting the need to keep those things separate. Right. I was joking with my colleagues that, you know, we know that pre-existing medical conditions are a risk factor for adverse outcomes in COVID. We don't want to add pre-existing political conditions as another risk factor.
That's right. Now, Dr. Senu, I'm going to have to stop you just for a minute because we've got all these questions coming up, and those are really good points. And that, you know, we could have a whole hour long, many hours on the whole political mess, and I'll just call it a mess. But so Tropikana's got some questions here that, you know, we need to get back to those. Just Tropikana, jump in.
In regards to flu season, I myself I don't think I'm a new mommy anymore because he's 4. So I feel like I'm a little bit experienced. I'm like in the almost intermediate mommy group now. I'm almost getting my stripes. But I
My
still
mom
have
said
a
it's
lot
always
of
a learning experience.
listen for the rest of my life and every day. But in my conversations with other new mothers, I have a lot of new mommy friends and a lot of new mommy followers, and we are all concerned. And I'm sure that you get these questions all the time, but I got to address them for them. One of the things that Black mothers in particular fear are vaccines and the flu shot when it comes to our newborn babies, our toddlers, my premature son. There is just such a fear as a mother of inserting anything into you or into your child. So can you kind of dispel some of the myths or the fears? You know, they tell us that vaccines cause other health risks later on in life for our babies, and especially our Black boys. Same thing with the flu shot, that I'm giving him the flu. How is this going to help him keep the flu down? And I got to protect him from COVID as well. So can you guys kind of speak to that?
Yeah. So one of the things I do a lot, because I do infectious diseases advice on vaccines and advice on, and we've studied vaccines for decades. Vaccines have been around for a very, very long time, and they have been incredibly, incredibly helpful in preventing deaths. I think a lot of times what people, and especially our younger generation, is we quote unquote have been spoiled because we didn't see the impact of diseases before the vaccines were developed. So measles, how measles impacted kids, polio, how it really devastated lives for people. And if you lived in an area where these diseases are still prevalent, you would see how devastating these things would be, and you can see the impact of vaccines, how vaccines have improved the lives of people who have these diseases. So vaccines have been around, and millions of doses of vaccines are given, millions of doses every year throughout the world. Um, are there going to be adverse events? Yes, there are going to be adverse events, but compared to the devastation these diseases cause, it is definitely minimal. It's not even close to what the benefits of vaccines. And vaccines have been studied extensively for adverse. In fact, we do this all the time for new vaccines. Not only do they go through a rigorous process before they get approval, even after the approval, there are mechanisms in place to monitor them, to look for adverse events and side effects. There are registries that are established in different countries where people who have adverse events can call into and report those adverse events. So there are mechanisms by which we monitor these vaccines, and for vaccines to and these things have been around for decades. So there is very little cause to believe that vaccines will be harmful for most children. And where there are problems with giving vaccines, sometimes kids have allergies and things like that. There are ways to address that. So we monitor for those things, and I want to assure the public that vaccines are really safe.
Okay, thank you for that. And Dr. Melba Moore, I know that you can see these things as well. Although having access to information should be something that is more helpful for us, especially my generation and younger. You would think that we would do more research, but we kind of just get stuck at what sticks out in those conspiracy theories. So a lot of that fear comes from things that we have seen with maybe the Tuskegee Airmen or the different things and experiments, and we keep it there. We don't even think outside of the fact that there are different countries who struggle with these same diseases, and we leave it there as well. So just for that, we don't have a lot of wise voices who are speaking to us and saying, yeah, that happened there, but here's how we counteracted that. Things have changed. Yes, that happened to us as a people at this time and in this generation, but here are the ways that we have progressed by having more Black doctors and more Black health commissioners who are here to protect us as well. So thank you for addressing that. And it would also be great if you can kind of speak to that too, to if I'm on the right track with that.
You're absolutely on the right track. And there's nothing like your girlfriend, or I have several sisters, but my one sister keeps it real, right? I trust her. Tell me you shouldn't do that, and I'll go, why not? And then I'll go, I guess I shouldn't really do it, right? So a trusted voice. We know people listen to those trusted voices. Don't sell yourself short. I'm telling you, I'm not going to tell you how old I am, but I'm listening to you. I'm listening to you. I listened to Lando when they told Renee, hey, you need to go here and set up that testing. And we had more people tested there than we had at some of those other sites. So you know I'm gonna come back and keep listening to you. As we came back to you and you gave me another site, and we're gonna go there next Saturday. So it's the trusted voices. And the thing, you know, for me as a healthcare professional, it's talking to Jan-Michele. I remember one night she was trying to kind of calm me down, and I was talking about how the mind takes a picture of a negative situation every 25th of a second. And you hold on to that, you do, until somebody comes along and changes that. But if I'm in a situation, Tropikana, every week, somebody's encouraging me and say, if you do this, this will happen, and it never happens, I'm gonna start looking at you strange because it's not changing, right? And here's the other thing that we did in St. Louis too, and I said it here. You know, when we mess up, we need to say we're sorry and that we know better now. We didn't know what we should have known then. But you know, then we got to dissect the ego and the pride and all of that. Right. I will say, if I make a mistake, I'm sorry. It wasn't, you know, charge it to my head, not my heart, right? But if I keep making that same mistake, what's up with that?
Right.
So it's very, very important that we have trusted, respected voices in the community, in all of these communities, delivering those messages. Like I used to be a health educator with going in talking to moms who had a baby. Well, I hadn't had any children. So, but when they would ask me that, I had my partner there.
Right.
Who had children. And she was echoing the same thing that I was echoing that was in the materials. So you got to have somebody to co-sign what you're saying, to back you up. But it's the trusted, respected voices. And then when we see stuff is wrong, somebody saying something, you know how in some communities, people say, oh, so-and-so said, if you got that, you know, this is gonna happen to you. Well, somebody else's so-and-so needs to come back with some facts.
Right.
Clear that up, because that will just roll and continue to roll. So it's very important that we have trusted, respected voices. So when I talk about young people, I'm looking to you and Lando to tell me, because I'm not in that age group. And what impacted me earlier, I might have been afraid of my parents and listen to everything that they said. And you come along and you give me some wisdom and some knowledge. And I want the community to understand, we need to embrace each other. It's not about, I'm 60 some years old and I know everything. How can I know everything and still be here? You know what I'm saying? Right. So we have to listen. I have to listen to you, respect you, because you're gonna give me wisdom and guidance in what I need to do. So that's just my, my slant on, I understand that there's a lot of distrust out there. Keep your head up, listen to those trusted voices, ask the questions. And sometimes, we'll all tell you, listen to your gut.
There you go. Well, you know what? That's why it's so important to have all of you on our town hall meeting, because you are the trusted voices. And so we appreciate all of you. Let me ask a question that has come up several times about this. If you get, so this is really, specific. If you get a flu vaccine, so that, and just can explain how that works. But my understanding is they're putting a live vaccine, they're putting a live flu virus in your body. The fear is that I keep hearing, will that make you get COVID, or will, does it lower your immunity to fighting off COVID? How does that work? Because you're putting a virus in our, when you get the vaccine, you're getting a virus.
Compromising our immune system by entering that virus or that vaccine. That's
So
a question.
let me answer that a little bit. So a couple things. The first thing I want to say is that so the flu vaccine, there are different kinds of flu vaccine, and for the most part, the one that we give is a killed vaccine. The flu vaccine that is live, we don't use a lot anymore. So the live vaccine, so vaccines can be, so let me explain what the killed and live means before we even get into the details. So a vaccine can be live. When we call a live vaccine is we take the organism, so in this case, influenza, which is causing the disease, and we weaken the organism. We don't kill it, we just weaken it. And then we put that organism in the body, or we give it to the patient. The idea is to, because the organism is really weak, it won't be able to cause a disease. And so that's why we give them that organism, because it's very weak. Now with influenza, most of the vaccines we use for influenza are not even live vaccines. They are not the weakened influenza, they are killed. Now, so as against having a live vaccine, which has weakened organisms, you can also have a vaccine produced from the organism which has been killed totally. So it's not live at all, it can't replicate, it's killed. And that is what majority of the flu vaccines we get. Any flu vaccine we get as a shot is a killed vaccine. The only flu vaccine available that is live is the one that was given through the nose. It's called a nasal spray. All the other ones that are given as shots are all killed vaccines. So the killed vaccines are not, even that possibility of getting flu from the killed vaccine is not realistic because the vaccine is, the virus is dead. So that notion has been, I got the flu shot, I got flu from the flu shot. It's not feasible, it's not possible because the virus is killed. So you can't get flu from the flu shot.
All the time, people say,
Right.
I got a flu shot and then I got sick. So what's up with that?
Right. So no, it's not now. Getting the flu shot. Now remember, the idea of the flu shot is to stimulate the immune response to react, right? To generate antibodies. Now that process can sometimes cause people to have, because even though you don't have flu, you're priming the immune system to act as if you have flu. So that process may cause some people to have, some mild symptoms, but that is usually very short-lived, and it's not influenza, and it's not nearly going to be as deadly as if you get the influenza. So that may happen, but it's not the same as getting influenza at all, and it's not as deadly as that. So that's a clarification that's important. You are not going to get influenza from a killed influenza vaccine. No, you're not going to do that. So that's one thing we have to clarify. Now, vaccines, one of the things we study when we're studying vaccines, especially even vaccines that we give to kids, you realize that when you're a kid and you're taking your kid for a shot, they give multiple vaccines at the same time and on the same visit. And that's one thing we study. We study whether vaccines, like if we're given 2 vaccines at the same time, whether it will impact one. So that's one thing we do research on before we come up. So that's why you have specific vaccine schedules so that their timing is spaced. And so if there's any danger where one will impact the other, that is evaluated and we make adjustments for that. So this is going to be strongly looked at, even for the COVID vaccine. And if there is any concern about having the 2 at the same time, we will not give it at the same time. But you should get a COVID and you should get a flu vaccine for sure. And if there are any concerns about simultaneous administration, I think that will come out when those recommendations will be addressed when the guidance has come out. When it should
Okay, so and Dr. Moore said that flu season is October through May. So that means now. So we all need to run and get these flu shots, go to health clinic or, your little clinic in Kroger or Walgreens, CVS, go get that flu shot today, right? And it's going to cause the flu. Lando?
I got a question for Dr. Senu. Is it possible, does the strands mutate like each year? Do they evolve? Because the reason I'm asking that question is, if you have a vaccine and then there are different strands, but you're giving me a vaccine for the strands prior, how will they cripple, or how do they protect you from getting the new strand?
That's a great question.
Yeah, very good question. So the answer is yes, they do. But that's why one of the things we do that's why every year there's a vaccine. Honestly, if it wasn't mutating, we'll just give one vaccine and forget about it. But that's why we have to accommodate for the mutations. And that's why we give a vaccine every year. So the vaccine you're going to get this year will try and accommodate for the mutations that have occurred. And so what we try and do for many months before the vaccine is made available is try and predict which of the flu strains will be circulating for that flu season. So the months that are leading to, that's why between, when usually the vaccines are available, August, September, the months up to that, a lot of researchers are working, collecting flu samples from strains from all over the world, from China, from South America, trying to predict which strain will be circulating in the US during the flu season. And so sometimes we get it right, sometimes we get it wrong. And sometimes the vaccine effectiveness, ranges, if we get it right, we get it better. That's why some people can still get the flu shot, but still get influenza, because maybe the vaccine doesn't match up to the strain as much as we expected or we predicted. So yes, the short answer to your question is, it does mutate, and we're in the business of trying to predict those mutations, and that's why we give flu shots every year.
So one question.
Lando, go ahead. I'm sorry.
I didn't mean to cut you off because that was such a great question, but similar to that, a question that just came up about flu shots was, how much do they cost? Because some people are saying, a lot of people are struggling now, and trying to make it. And now you all want us to get these flu shots. So what are they going to cost?
So I'm not. The flu shot depends on your insurance. I don't know how much is charged for the flu shot. It definitely depends on insurance. I don't know the actual dollar figure.
I'll be right with you, brother, when I get off the Zoom.
Okay, bro. Okay, Lando, you need to mute, sweetie.
Oh, I'm sorry. I'm sorry.
That's okay.
I have a question for Melba.
Yes.
This is Renee. I'm sorry. It was about the flu shot. I was just wondering, can you get the flu shot at the city clinics?
Yes, you can. You can get it at the city clinics as well as Kroger's. I saw signage out at Kroger's as well, but you can come to the city health department, to any of our health centers, and receive a vaccine as well, a flu vaccine. Yes.
Is there a cost?
You know what? I was sitting here and I went totally blank. If you have insurance, it would be covered, but I don't know the cost. I'll have to find that out, Renee, to get that back to you.
Okay, well, we will post that because, what I heard was like there's a sliding scale, and so it's really cost effective. It's not expensive. If you have to pay something, it's a small amount. A lot of people don't have to pay anything. So Dr. Moore is gonna check on that for us, and we will have the information on COVID-19 communityresources.com. So that was a really good question. Lando, I think you were about to ask another question. I don't know.
Yeah, yes. The other question I was going to ask is does that also apply to COVID? I mean, was it a mutation, or does it continue to mutate as well?
Yeah. So yes, the short answer to your question is yes. Now, yeah, we've looked at, and there's actually a website for the science geeks called next.org, I think is what the name is, which looked at all the strains that are collected from all around the world. And what we call it sequencing. So where you can look at the DNA fingerprint for each of the viruses and look at, it's actually very powerful too, where you can look at the DNA fingerprint from all the viruses and find out, okay, the one that's coming from this area, you know, does it have a particular characteristic, or the one coming from another area, does it have a different characteristic? So we've done, a lot of people, not we, but a lot of people have done that for COVID-19, and they found that, yeah, there are strange differences for COVID, for the virus that causes COVID-19 is called SARS-CoV-2. So, I mean, I use COVID-19 just to keep it simple, but the virus is called SARS-CoV-2. So SARS-CoV-2 has been studied, and different strains have been studied from all around the world. And there have been some mutations and different strains, like strains from Africa and strains from Europe and all these other places. What is unclear is what these mutations mean. Do they mean a difference in virility? Do they mean a difference in transmission? Does it mean that, you know, one strain is easier to transmit than another? That's all not clear yet. But there are different strains that are circulating, and those strains, and in fact, in the US, it doesn't mean that there could be a predominant circulating strain, but there are several strains circulating at the same time, is what I'm just trying to say. It's not just one strain circulating in the US at the same time. And you don't know.
I can already hear people saying, as they say with the flu shot, so, you know, why get vaccinated? Because by the time you get vaccinated, there's going to be another strain out there.
Right.
Well, let me touch on that, and that's an important question. No, so the strain mutations for influenza they can be quite frequent, and they could impact antibody development in such a way that, you know, when there's a strain that's mutated, the new antibody or the antibodies that are formed from a subsequent strain may not affect the first one at all. We don't know if that's the case for COVID. So in other words, if you get a strain of antibodies to a particular strain, would that antibody still protect you from the next strain? You know, and that a lot of people think that is more likely for COVID than it is for influenza. So strain mutations don't mean the same thing. They may mean one thing for influenza and may mean a different thing for COVID. You can't necessarily say that they're the same.
Okay, all right, that makes sense. So we're still saying there's a huge advantage to getting vaccinated.
Right.
We're still pushing that. Okay.
Right.
You know, we're going to talk about the COVID vaccine next week, but you know, just to ask you, you know, do you think people should go ahead and, you know, be involved in these studies, and, you know, just give us like a quick statement on that?
Yeah, I do a lot of research. In fact, I spend 75% of my time doing research. So I believe strongly in research. I believe, like I've said it in the statement before, I think the best way we can improve our health is through science, and science is guided. Science research is a huge component of science. And so I believe strongly that, you know, Black and brown people and minorities should participate in research. However, I am very well aware of the trust Black and brown communities have placed in scientists and researchers, and how that trust has been abused in the past. Mm-hmm. So my take, when I say this, and I say this when I hear, you know, oh, they want, you know, 20-30% of their participants in the vaccine trials to be Black and brown people, that is great. But we want to make sure that the same 20 and 30% is represented on the groups that are looking at the data. So when vaccine trials are done, there are groups that look at the data and interpret the data. There's something called a DSMB, Data Safety and Monitoring Board. Okay. Those are the people that are going to take the data and look at the data and make interpretations of the data. It's good to have Black and brown representation as participants or study subjects, but every step of the way, there should be Black and brown representation. So with the data interpretation, with the investigating, with the planning of the study, that is what I want to see. And I think that would help establish the trust that has been eroded in the past from all these activities. I believe, and all the researchers that I work with want to do the best science. They don't want to take advantage of people. But I think I can also see how events that are in the past, it's hard to just communicate that message if we're not showing representation in all steps of the way.
That's right. Absolutely. Yes, that's right. And let me ask all of you, do you think the fact that President Trump and First Lady Melania Trump and, a lot of folks around them got COVID will make people more willing to get vaccinated?
I think there'll be more people potentially to believe it's real. I believe it is left up to us to put information together in a format, and I'm sure Renee's gonna talk about that, in a format that we can best receive and understand, and bring people to the table to talk about the need. We have continuously had this need for recruiting minority into the medical field, minorities in clinical trials. We need to talk about why that's so important. So if you have two people who are in the trial and they equally represent the ethnicity that will need to take the medication, you get a truer read, which goes back to Dr. Senu's comment about trust. So I think it is us, it's left up to us to talk about that and to engage and encourage people. Again, knowledge is power. We have to overcome the negative that's out there. And we know that sometimes we seem to gravitate to the negative as opposed to gravitating to a strengths-based approach. We have some very smart people in our communities, and we need to continue to seize those opportunities to educate and impart factual information. And I know that's going to be coming up soon.
Okay, thank you. Here's another question that I've got to get in. So someone is asking, is there a connection between vaccinations, like flu shots, I guess, and autism, especially?
I know they were gonna.
I was trying to say without saying that earlier.
So yeah, I knew I should have probably touched on that when I was commenting on vaccine. So this has been something about vaccines and side effects. I should have. This has been something that has caused a lot of controversy in the medical community for a while. Actually, what happened, and there was an investigator, and I think he was in the UK or was in Australia. His name is Wakefield, but he was one of the people who published some data suggesting that vaccines could cause autism. And this made us, and the thing about the scientific community is that when we see things like that, we go we go all into it trying to figure out whether it's true and to disprove that. So it led, and this is almost 10 years ago. So it has led to a lot of studies that have evaluated vaccines for, that same signal. In fact, one of the suggestions at the time was that the mercury component of vaccines may be what is causing that. So one of the things they have done, just as a safety precaution, is that they took out that mercury component from the vaccine. So vaccines have been made without that mercury component.
So there's no mercury in any vaccine, you're saying?
So it's called that. We took out that. Okay. So and that's to be on the safe, not because what he said was right, but just to be on the safe side. And so that has been very well investigated, and I don't think and we have, up to now, we haven't found any evidence to support those notions that autism is caused by these vaccines. So that's. And
Dr. Senu, wasn't that article removed from?
Yes, that's a good point. Yes. That's a very good point. So that article was retracted. Yes. So there were a lot of issues that I'm glad you mentioned that. I would have been complete without stating that. Now that study had so many problems that it was actually retracted from Lancet. Lancet was the journal in which he published the article in. So that article was actually retracted. So but again, the scientific community wants to do no harm. So even just out of abundance of caution, they took out the mercury component of those vaccines. But the article, as rightly Dr. Moore said, the article was retracted.
Okay, all right. That's really good to know because that comes up a lot. And someone said, please ask about autism. So thank you. And Tropikana brought that up earlier. You know, we're running out of time. So Tropikana and Lando, my moderators, is there anything you want to add before we start closing out?
I just want to say thank you. As always, thank you. Dr. Melba Moore, thank you for being a voice that we can hear and relate to, and even having the care that you have for the community that you serve. It's a blessing. I have lived in a lot of places around the world and country, and this is maybe the first time that even as a radio personality, I've actually been able to have a conversation with the health commissioner of the state that I live in. So it just says a lot how much you care about us, and it shows. It makes it much easier for me to do my job and for them to believe the things that I say because they can see you. So thank you for just being a mainstay in the community and a pillar that is actually giving back to get this information out to us. So thank you for making me a stronger, putting me in a stronger position to be able to help the people that listen. So thank you. Dr. Senu, thank you for even taking the time to answer all of those questions and debunk those myths, because now I'm about to look like the person that knows everything in my mommy chats, because we don't even have mercury in vaccines anymore, because get over it, girl. We don't even do that no more. They been took that out for y'all. So I got it. Thank you guys so much for everything.
That is great. That is great. Lando, did you want to pitch in and say anything?
Yes, I want to thank Dr. Senu and Dr. Moore, as well as the Health Gap, for providing this platform, and Tropicana for all the work of keeping the community connected, because that's the only way we can communicate, is having those connections. And I want to thank you, Jan, for always being so polished on this moderation. I mean, they need you at the next presidential debate. They really need you there to control that.
Yes.
Yeah, they were saying what they really need is someone who's a mom and knows like how So I want to thank all of you. I mean, you know, Dr. Moore, you are just a treasure to our city, and you know, we would not make it through this pandemic without you. And so, you know, and you do so much more than COVID, you know, but right now everybody's so focused on that. And you have just been such a great leader. You always have been, and we really appreciate you. Dr. Senu is just great. Dr. Senu Apawakin, because we're gonna love to say that name. Dr. Senu Apawakin from UC Health. You know, we're so proud of you, and you've got so much knowledge and just a great personality. And you know, you make it easy for us to understand. Sometimes like medical people get all caught up in the lingo. We're like, what are they talking about? So you really broke it down for us, and we just appreciate that. You know, Lando and Tropicana, you guys have such a huge following, and the fact that you take the time to make sure that, you know, your communities, the people who are following you, and there are just a lot of folks out there to make sure they get the knowledge they need. That is so important. And you all are just wonderful leaders too. And I just, you know, really love you guys and just appreciate you. And I'm turning it over to our fearless leader, Renee Mahaffey Harris, our president and CEO from the Center for Closing the Health Gap, who makes it all happen. Renee?
I know I'm making all kinds of faces because, you know, I don't really like to hear all that. So, so I have to work on my facial expressions. But first of all, I want to thank all of you. This was a really important conversation. And, you know, I can't say enough for Lando and Tropicana and Dr. Moore and Dr. Senu, thank you. I have been saying to many of the people that are raising these questions about vaccines right now and about everything that we're dealing with COVID-19 is do not ever assume that we don't understand what you're saying. It is your job to help give us information so that perhaps people like Tropicana, like Lando, can then be able to process it and share it with their peers, because we need to make sure that the information is understood, that people have accurate information to share for us to even begin to address the mistrust that began in this country 400 years ago, 100 years ago, 50 years ago, and today. So I'm just really excited that we have such great leaders in our community that are willing to take time to share the scientific side, but then also in sharing that, we can then begin to pull it apart and understand it and be able to speak about it in ways that we can each deliver to our peer groups. We we have a long ways to go, but I do know that together we will get there. We will get good information to our communities so that we can save lives and so that we begin to understand what power we have in knowledge. So as always, Jan-Michele and Kearney, Councilmember Kearney, we thank you for being our moderator. You do such a phenomenal job. A thank you to John and Lauren for managing those questions from Facebook Live, and our continued efforts to continue to educate and empower our communities with the tools to be a part of our own health solutions. So we thank you from the Health Gap, also from our other collaborators, Eric Kearney with the African American Chamber of Commerce, Eddie Keon with the Urban League of Greater Cincinnati and Southwest Ohio, Joe Mallory with the NAACP, and Dr. Roosevelt Walker with Cincinnati Medical Association. You all have a great weekend, and we look forward to seeing you next week as we talk about clinical trials.
See ya.
Thanks, everybody.
Bye, guys.
Bye-bye.
Bye-bye.
Bye-bye.